recording in my computer. Now you see if you can record in the iCloud.
I've started. Has yours stopped?
No, my one is fine.
We found a hack.
So you are recording now?
Yes, I am recording.
Okay, so this should be the way. Like if I start recording in my computer, then you will be able to record in the iCloud. Because when I was trying to do it, it gave me an option that stop recording in iCloud. Okay,
Yeah.
I'm all set. I'm in my computer. Okay. And you hear me good? Sound is good?
Yeah, we can hear. Yes.
Video is good? Okay, thank you.
And then for everyone, Ushaji, when we're about to begin in a minute or so, you may please make the announcement that if people have queries that are personal in nature, they don't want to be named, they can type them to you and you can read them out. And that way, because this is streaming on the internet and it's staying on the internet and they don't want to have a personal query here, it's all right. They can type it to you and you'll be able to read it out to Dr. Sarkar.
Yes, and also, Ushaji, you read the chat, any question, comments, then you let me know because it's hard for me to present and read the chat at the same time. So you read the chat. If you have any question, we can do a question answer after the presentation. And if any comments, you just let me know.
I will do that. Absolutely. Absolutely.
Thank you.
Where are we on time?
Dilip, this is night time for you. This is Sharma.
Hey, Sharma, কেমন আছো? কেমন আছো?
ভালো আছেন? আপনার নাম দেখে আর থাকতে পারলাম না, ঢুকেই পড়লাম।
আরে আমার নাম দেখে, তোমার নাম দেখে তো আমি সব জায়গায় যাই। তোমার নাম দেখে আমি SBS তে চলে গিয়েছিলাম।
Yeah, I know.
He's an old friend of mine. We met him in Vajrasana in Bangalore, Yoga University.
Wow, okay.
Yeah, small world, you know.
Nice, nice.
His brother is a classmate of mine, so it's been very close.
My younger brother is a classmate of his, you know.
Okay, I think we should start now, Gauravji. Okay. Namaste and Swagatam, dear friends. I'm Usha Narasimhan, and I take great pleasure in welcoming you all to today's workshop, which is entitled Yoga Therapy from Transition to Transformation. Intriguing title, isn't it? Let's not waste too much time, but just initiate this session with a short prayer that will take us into our own private protected space where we can safely enjoy Dr. Sarkar's learning, his wisdom, and his experience. Please sit comfortably with your back straight. Relax your facial muscles. Relax your shoulders. Relax your abdomen. Let's take a few deep breaths. Inhale. As you inhale, watch your belly expand and let go. Inhale. Let go. Inhale. Let go. Inhale. Let go. One last. Hands folded gently at your heart center. Close your eyes and let's start our prayer. Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvinavadhitamastu ma vidvishavahai. Om Shanti Shanti Shanti. Friends, it's an honor and a privilege to introduce to you all such an eminent and distinguished Dr. Dilip Sarkar. Dr. Sarkar, MD, FACS, CIAYT, D.Litt, and Chairman of the Center for Integrative Medicine and Yoga, Taksha University, Hampton, Virginia, is a retired vascular surgeon turned yoga acharya, certified yoga therapist, certified Ayurvedic yoga therapist, and Ayurvedic teacher. He retired as an associate professor of surgery at Eastern Virginia Medical School, Norfolk, Virginia.
Possibly by Friday, that's when the CDC advisor board will meet and resuming Johnson & Johnson.
Usha Bala. Okay. And now teaches yoga therapy, Ayurvedic philosophy, and Ayurvedic yoga therapy, both nationally and internationally, to healthcare providers with a focus on integrating yogic and Ayurvedic wisdom with the science of Western medicine. Dr. Sarkar started the first Category 1 ACCME approved continuing medical education course in the USA for physicians, yoga therapy for medical professionals in 2010. He serves on several local and national healthcare boards. Past president of the board of directors for the American Heart Association, Hampton Roads Chapter, Virginia. Past president of the board of directors, International Association of Yoga Therapists. Past chairman of the board, Life in Yoga Institute. Life member, National Ayurvedic Medical Association. He's a fellow American College of Surgeons and fellow American Association of Integrative Medicines. On January 12, 2019, during the annual convocation, he was awarded Doctor of Letters degree in yoga by the best yoga university in the world, Swami Vivekananda Yoga Anusandhana Samsthana of Bengaluru, India. His new DVD, Yoga Therapy for Health and Healing, A Daily Practice, and his book, Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence, published in April of 2017, have both been well received by the yoga therapy, Ayurveda, and Western healthcare communities. The book will be translated into Bengali and will be published in India by Ananda Publisher of Kolkata, India. Thank you again, Dr. Sarkar, and we welcome you today.
Thank you. Acha, Gauravji, okay, you are putting me a spotlight for all and also mute everybody except me.
I'll mute everyone and you are spotlight, yes.
Yeah, I'm on the spotlight. Put me on the spotlight for all and also mute everybody except me.
Okay. You have to unmute yourself, Dr. Sarkar. Everybody else has been muted and I'm about to spotlight you.
It's okay, I'll do it. Yes, I've unmuted myself. Can you hear me now, Gaurav?
Yes, we can hear you and we can see you. You are spotlight. Thank you.
Beautiful. Okay. Good evening for West Coast, and I'm from East Coast. I'm also 9 o'clock, past 10 minutes past 9. Thank you for inviting in the American Institute. It's a wonderful place, and you are really doing the whole yoga practice. The real yoga is Nishkam Karma, and you are really doing excellent Nishkam Karma, selfless service. So today, our topic of discussion will be the yoga therapy, a transition to transformation. And I'm going to show you some practices which creates the transformation. So let me go ahead and give you a little bit of a little discussion and definition. So we have all the experienced yoga practitioner, yoga teachers, yoga participants are here. The first, this yoga is an anglicized version of the word, the yoga. So I'm going to use the word yoga from now onwards, and I'm not going to use yoga anymore, because we are actually teaching purely from our scripture. So the word yoga is a union of your body, mind, and spirit. And therapeutically, the way we talk, the body in a computer metaphor, body is the hardware, mind is the software, spirit is the programmer. So if you can fix your software, hardware will be fixed. And a practice of yoga literally causes the fixing of the software. And who is the programmer? Programmer is a you. You are going to reprogram your software so your hardware will be fixed. On the other hand, in the whole Western medicine, I'm a Western trained physician. Western trained physician is looking only in the hardware in the body. So if you don't fix the software, hardware will never get fixed. It's as simple as it is. It's a philosophy. And if you look at the philosophy, the Yoga Sutra of Patanjali, 196 sutras, of which 193 is to quiet down your mind. So whole your practice is to take care of your software. It's like the software updates. You get in your cell phone, like iPhone, you get the updates for iOS. The practice of yoga is an update of your software. As simple as it is. The whole practice, look at the whole 8 limbs, Ashtanga Yoga, Yam, Niyam, Asana, Pranayam, Pratyahara, Dharan, Dhyan, Samadhi, is also geared for self-realization and quieting down your mind. Remember, the whole practice of yoga was never designed for any health benefits or health outcome. It was designed for self-realization. And the way I say about self-realization means you develop a real eyes. Now the eyes are turned backwards. You start looking inside yourself. And really what you are finding it out, introspection, you are awakening the doctor within you. And the doctor within you is guiding you to get out of the condition today, which say practice of yoga causes rogir chikitsha, treatment of a disease, and swasthya, maintenance of health. If you look at the word swasthya, the original derived word comes from sha, sthir. Sha is yourself, sthir is a stillness. Stillness of your body, mind, and spirit is your therapeutic outcome. The moment your body is still. So what is the asana which is going to create a transformation, and what we transform? We transform from a rogi, we are all rogi, we have underlying a condition, rogi to nirogi, finally to yogi. So we transform from rogi to nirogi to yogi, and that is the ultimate outcome of the yoga practice. During the practice of yoga, it is being infused with mudras, bandhas, kriyas, Ayurvedic philosophy, and it became a yoga chikitsha. That becomes yoga as a therapy. So yoga therapy or yoga chikitsha basically is the adaptation of the practice of yoga, including your Yoga Sutra of Patanjali, Patanjali Ashtanga Yoga, and learning how to use it based on the patient's or client clinical condition. A transition, what it is, transition is temporary and transformation is permanent. So what does it mean? If you practice yoga, like say I'm here, I'm sitting in a Sukhasana. If you want to practice with me, it will be great, and you'll see how beautiful way of practice it is. So you start a Sukhasana, or you start even sitting in a chair. The first your component is practice is called Merudanda Achal. Like the one Ushaji was saying, sit down, the spine straight. The moment you keep your spine straight, what happens? A relaxation response sets in. What does it mean by relaxation response? Here, my skeleton, if I'm standing up, is going to fall front. All the muscles in my back contracting and keeping me up straight. So there is a large number of muscles that are tight, and it feels like a two piece of brick sitting here. The moment you sit down with your spine straight, you relax this back muscles. And I'll show it to you. How do you transform slowly and it becomes a permanent? So in your practice, the moment you start practicing, you will develop a physiological changes. And how do you know? We use it. This is my Apple Watch. It is recording all my health parameters. It is recording my EKG, recording my heart rate, recording my blood pressure. I know exactly what is this Sukhasana is doing to my body's physiological changes. But what happens that if you have these changes are not permanent. If you stop doing yoga, it will go away within 4 to 6 weeks. The changes will not be there. But the transformative practice, what I'm going to show it to you, a transformative practice, the transformative practice will be like I call it effortless ease. Effortless ease means our brain allows me to do that without knowing. What does it mean? What it means, the brain has a function which is called a neuroplasticity. Neuroplasticity means if I have enough input, so I'm sitting here in a Sukhasana. I'm not sitting like this. My brain is allowing me to sit like this because I sit in this position maybe 10, 20, 30, 40 times with input. The brain gets a signal, that's when I need to sit down, and it allows me to sit with a comfort, what is called Sthiram Sukham Asana. The moment you come to a Sthiram Sukham Asana, you start your effortless ease. Now, how to start? Suppose you are putting Sukhasana, put your both the feet, cross it in the middle, keep your spine straight, trying to sit down, and you get a pain. The moment you get a pain means pay attention. Body is telling you, you have crossed your limit. So what you do, you go ahead and back off a little bit. Find a posture where you don't have any pain, but you have a little discomfort, called comfortable discomfort. But what is in transformative practice in yoga is that you are able to stay in this posture for an extended period of time. Again, what does it mean? The moment you come to this posture, your muscles are contracting, ligaments are contracting, body is allowing you to come to this posture. But if you stay in this posture with few other components, the first component is what keeps us awake, alert, is called our mind. Mind in yoga is the content of our five senses. In our fifth limb called pratyahar. Pratyahar. Ahar means all the input. What I see, the five senses, I see, I hear, I smell, I sense, and I touch. All the input from the five senses, you put it together, and the moment you learn how to control the five senses, that is the fifth limb called pratyahar. If you learn how to do pratyahar, you will see the relaxation response will set in. So how to do that? The first you do, you can close your eyes and you will be surprised. The moment you close your eyes, relaxation will set in. But for a transformative practice, we use a yogic practice, what is called a Bhramri Pranayama. So what will happen there? Initially, all the muscles and ligaments which are all contracted, and this is a position of the asana called Arambho. Arambho is the beginning. Muscle cannot contract it that long. It will start relaxing. Before it relaxes, it causes a little fasciculation. And the fasciculation goes away. It's called sthiti. Arambho, sthiti. Then you had a profound relaxation, which is called Visarjana. 3 stages of asanas in Sanskrit: Arambho, Sthiti, Visarjana. When the Visarjana comes in, slowly and slowly, this thing is going to happen without knowing. So that means you do not practice yoga. Yoga will come to you. What you practice removing the bugs in your software. The moment you are manasthir, all the relaxation will take place. When the 3 stages of asanas takes place, Arambho, Sthiti, Visarjana, transformation will take place. And in the transformative practice, you will never know even you are sitting like this. So transformative practice in the morning, you're brushing your teeth. You really don't even think of brushing your teeth. We do the whole daily routine called Dinacharya. I'll show it to you what we do the Dinacharya. Wake up in the morning, sit down in a malasana, drink a glass of water, but I'll show it to you. So this is your relaxation. So the moment you can do a transformative practice, sit down and let me show you one time the 2 practices you will do, which will bring your mind in a quiet down. First, in a Bhramri Pranayama, what you do, you shut down all of your 5 senses. Then you create a frequency. And we have a lot of scientists are here in the audience, or a physicist. 2 frequencies. Our brain has a frequency, and you create a frequency. 2 frequency interacts, cancels. It's called harmonic resonance, and mind quiets down. That's the principle of Bhramri Pranayama. So you put an index finger in the forehead, use your 3 fingers to close your eyes, use your thumb to close your ear, close your mouth. You do all the breathing through your nostril, not through your mouth. There's a lot of reason for it. I'll explain to you. Breathe out first, because the lung needs to be emptied. Take a deep breath in through your nose. Breathe out with the sound of a bumblebee. I have absolutely no idea where it was. Next, you do pumping and cupping. Use both the hands, keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Take both the hands like a cup, put it over your eyes like a cup. Let the eyes take all the heat from your hand. This is a relaxation of your eyes. When the eyes are tight, remember, eye is an extension of your brain. Your mind is just at a restless. So eye quiets down, slowly massage your forehead. All the muscles in the forehead is attaching the skin. Massage your eyes, your face, massage your ear, massage behind your ear, in front of your ear canal. This is called the auricular branch of vagus nerve. It is called a vagal activation. So practice of yoga is called a relaxation response and activation of parasympathetic tone. Parasympathetic tone is called coming and digesting. Slowly bring your hand, massage in front of the neck. There are two organs called a carotid sinus. Carotid sinus massage activates your parasympathetic tone. It quiets down your cardiovascular system, quiets down your nervous system. Then you take your hands to the back and massage in the back the insertion of two muscles called trapezius and sternocleidomastoid muscles. They're supplied by a cranial nerve, the nerve coming through your brain. It elicits a profound relaxation response. Next transformative practice is activating both sides of your brain. Remember, you have a bicycle. If one tire doesn't have a pump, that bicycle is not going to work. So we are always right-handed, right-footed. I'm always using right-handed and right foot. Try to use your left hand. Throughout the whole day, therapeutic yoga is not the practice you are doing. You do half an hour practice, 45 minutes practice, 1 hour practice in the mat. Therapeutic yoga is what you do the next 23 hours. That's your therapy. So look, see how simple practice is this. I'm sitting like this. Now I see if I can change my feet and do like this. I'm activating opposite side of my brain. It is little discomfort now because I'm not used to sitting like this. But if you keep on sitting here, neuroplasticity will sit in and body will allow you to do it. The moment you do that, you now use your hand called the mudras. What the mudras are? See, this is the one thing you have to remember, that we have all the sequence, yam, niyam, asana, pranayam, pratyahara, dharan, and samadhi. You now learn how to incorporate or include different components in a matter so that you can use as a therapeutic purposes. Remember one thing, the whole lifestyle related disorders, diabetes, hypertension, heart disease, truncal obesity, arthritis, back pain, it all comes from stress. Stress is nothing but activation of your sympathetic tone. And the practice of yoga is activation of relaxation response, activation of parasympathetic tone. Now I'm already relaxed. When you relax, you can see I'm relaxed. I can watch on my Apple Watch, or I can watch, I have a saliva in my mouth. When I'm talking to you for half an hour, but now my mouth is still wet. What does it mean? When you have a sympathetic overdrive, when you are fearful, your mouth dries up. So mouth gets wet, that is your indication. You are relaxed. Now you can do the next step, is called a Siddhasana. Take your heel to the back, put your foot on the top, your knee drops down. But if your knee doesn't drop down, it is here, let it be here. If you push it down, what will happen? This will happen. But the moment you incorporate the relaxation response, this will happen. So your hand is a connector between your body and mind. Remember, my hand moves before my tongue even moves. I like something. I say, Gauravji, before I can say this good. I want something, Ushaji. before I say, give me something. So the hand is a connector. The hand and the mudras are called a psychophysical connector. I mean, it's a connector between body and mind, and mudras guides your prana to the organ of healing. That's why mudras are called healing in your hand, health in your hand. Ayurvedically, it's a Pancha Mahabhuta, Akash, Vayu, Agni, Jal, Prithvi. Akash is the middle finger, Vayu, Agni, Jal, Prithvi. Lot of mudras, Dhyana Mudra, Vayu Mudra, Shunna Mudra, Prithvi Mudra, Varun Mudra, Shakti Mudra, Apna Mudra, Apna Vayu Mudra, Linga Mudra. But the mudra which quiets down your mind, let me show it to you, and you'll be amazed that you do it all the time. See, our mind doesn't have any focus. Our mind, we've got a monkey mind, it is jumping up and down. We talk about meditation. I say, I want to meditate. You cannot meditate. Why cannot meditate? Meditation will come to you. So what do you do to meditate? You practice your physical body first. You practice in your physical body a relaxation response. You practice your physical body as Sthiram, Sukham Asana. Then you use your breath. Lung is like a balloon. It has a 6 liter capacity. It needs 1.5 liter to keep it open. 4.5 liter you can exchange air. That is called a vital capacity. And we only breathe, every breathing is 500 cc, 0.5 liter. With 80 to 90% lung is reserve. So what we do in your practice, first you breathe out first. Why? You make room in the balloon so you can breathe in. When you breathe in, then you breathe out longer than breathing in. Why? You are removing all the toxic carbon dioxide and bringing more oxygen in, and the oxygen is a relaxation response, and that is your yoga as a therapy. That is from transition to transformation. So, when my mind is not in focus, see, when I'm paying attention to you, you know what happens? My finger comes together, I touch like this. This is called Hakini Mudra. Hakini Mudra happens automatically. If I'm talking to somebody paying attention, you will see my finger will come like this without knowing. That is called the effortless ease. Remember, dis-ease, disease, if you spread it out, D-I-S space E-A-S-E. Or in Sanskrit, this is called ashuk. When shuk is gone, that is ashuk. So this Hakini Mudra, I have done so many times. I'm in a conference. I'm seeing somebody's paying attention in a conference. I had so many candid camera of putting hands like this. When your mind is agitated, when your mind is agitated, you do mudra is called your Shankar Mudra. See if you can do it with me. Try it. Put your both the hands. Take your right hand, wrap your left thumb. Left hand, wrap your right thumb. Touch your index finger and thumb. This looks like a Shankar, conch shell. The moment you put a Shankar Mudra, close your eyes, keep your spine straight, transformation takes place. You do the opposite hand. Left hand, from the right thumb. Right hand, put your left around hand, touch your index finger and thumb, activating both sides of your brain. Now, in a yoga practice, with a physical body, then with the mind called a subtle body, with the spirit you call a causal body. So when you activate your subtle body, you develop transformative practice. What is a subtle body? Subtle body is a body of your mind. Like if I close my eyes, I can touch tip of my nose, I can touch my top of my head, I can touch my left knee, the right knee, absolutely there's no problem. So what will happen When I'm doing this, your Shankar Mudra, I'll be able to my eyes are closed now. I can clearly see my both hands and eyes closed. Wrap my left hand, I'm doing a Shankar Mudra. Opposite side, Shankar Mudra. My eyes are closed. The moment you can do that, your brain gets a signal. That is the time that it becomes an effortless practice. Activating both sides of your brain. Dhenu Mudra, Shurabhi Mudra. Touch opposite fingers of your hands. Hand is the most powerful. Mudras, remember, Bharatanatyam. Look at that. Hand mudras, you look at your eyes. Eyes connect to your brain. Brain connects to your heart. You are looking inside your heart, introspection. That is your healing. Activating the doctor within you. So, my right index finger touches left middle finger. Right middle finger touches left index finger. Right ring finger touches left little finger. Right little finger touches the ring finger and the thumb. Dhenu Mudra is like an udder of a cow, Shurabhi Mudra. You can do opposite hand, but the most important practice is you have to do it with the eyes closed. My eyes are closed, I can clearly do it. Now in the opposite hand, left index finger touches my right middle finger. Left middle finger touches the right index finger. Left little finger touches the right ring finger. Left ring finger touches the right little finger and the thumb. Eyes were closed. So wonderful practice. By the time you can do the practice like this, now you can take your feet on the top and you can sit down in a Ardha Padmasana or a Swastika Asana. They said I was having pain. So put in a position where you don't have any much pain but discomfort. Then also listen to your breath. Your breath has to be completely effortless. Why? Because of the Panchakosha, Annamaya Kosha to Pranamaya Kosha. That means any imbalance you create in your physical body, it shows up in your breath. So breath, effortless breathing means I'm talking, I'm singing. See, when I'm preparing my body and mind as a transformative practice, I will be able to do any asana. I've been in this world for a long period of time. You name an asana, I can do it. I'll be doing a Vajrasana, Mudras, I do Siddhasana, Samangasana. Any asana you can name, I can do it. Why? Because my software is controlling my hardware. My software is controlling. So it's beautiful. Here it is. Ardha Padmasana in one foot. Try Ardha Padmasana is the other leg. You'll see the difference. Activating both sides of the brain. So I've been practicing a long time. I practice, now I've been right-handed, I practice brushing my teeth with my left hand. When I started doing it, my hand was all over. My brush never came even to my teeth. By the time it took in my teeth, I'm brushing my left hand with all my teeth. You know what happens? My right hand is doing like this. Because brain has an imprinted memory. And that imprinted memory is a transformative practice that transforms you from a rogi to a nirogi. You know, Ushaji didn't tell you a little bit more. I had open heart surgery 20 years back. But my blood pressure is still normal. My blood sugar is normal. My cholesterol, everything is normal. What caused my heart disease? It's a global sympathetic overdrive, which is called a stress. And after this practice of the relaxation response, for the last 15 years, I'm off medication. I'm disease-free, medication-free. I'm enjoying a quality life. So whole transformative practices is called work in. So people say exercising. Why didn't we? Exercise is work out. Exercise is sympathetic. Exercise is muscle contraction. Exercise is your increasing heart rate, increasing blood pressure, increasing respiratory rate. But when there is sympathetic overdrive, parasympathetic response comes in. So in a relaxation response, what happens? Like I take the other foot and sit down in a Padmasana. I'm in a wonderful, relaxing state. People say, oh, look at him. How can he do that? It is so difficult. Remember what happened? I came in stages. Arambho, Sthiti, Visarjan. Then what you do, that you are breathing out longer than breathing in. Exhalation is longer than inhalation. And your transformative practice is your Bastrika Pranayama. Bastrika is a bellows. You can do very simply. You can raise your hand, take a deep breath in and out. But simplest way of doing Bastrika Pranayama, remember, transformative pranayamas are also has to be done completely effortless. That means the way you do pranayama as if you're doing a normal breathing. So let me show you simply. I generally use a mudra in my hand, which is called Adhi Mudra, thumb inside and close. This is also called a Balo Mushti Mudra, baby fist. When the baby will close hand like this. And babies are relaxed. So I will sit, put a Adhi Mudra, then simply I will do very rapid Bastrika Pranayama and effortlessly, as if it were normal breathing. You will be able to do it, but do it very slowly and gently. Initially made only 30 seconds. Good enough. Maybe 10 seconds, that's good enough. Listen to your body's signal and do not compete with anybody. So here is a simple practice of a Kapalbhati Pranayama, a Bastrika Pranayama. I can continue. I'm talking, I'm not just showing a little sample. Why? I practice every day. I did only 50, I'll be doing 500. But I'll be still talking, still breathing. Bastrika Pranayama is called a Prano Pradhan Pranayama. It brings the prana in your body. And the Kapalbhati Pranayama is the next transformative pranayama. You have a balloon here, you have a diaphragm here, another balloon here in the lung. You push your belly button inside, all the air comes out. It's an active exhalation, passive inhalation. Normal breathing is active inhalation, passive exhalation. Going against the grain of your habit is yoga therapy. Ayurveda says very clearly, law of opposite. If you have the gunas of the doshas, if you are vata, if you are a cold, you are a mobile, you are dry, what the vata does? Grounding poses. Vata will need an oily food, oily material. Kapha, on the other hand, will be using uplifting asanas. So law of opposite is transformative. As simple as it is. So the moment you do, I'm not doing with all the practices because it's late here at night, but I'm giving you, guiding you. That's what normally in a practice, I would do a complete Bastrika Pranayama. So continue Kapalbhati Pranayama. Kapalbhati Pranayama is called Agni Pradhan Pranayama. It ignites your Jathar Agni. We have Prana, Teja, and Ojas. Agni digests all of our food. When we eat our food, food converts into Saptadhatu, 7 tissues. Rashadhatu, Raktadhatu, Mamshadhatu, Medodhatu, Ostidhatu, Majjadhatu, Shukradhatu. Then you form substance called Ojas. Ojas is your body's immune power, and that is your transformative. Say, powerful relaxation asana is your Vajrasana. The moment you can sit down in a Vajrasana, your spine is straight, you are supported, you exercise a profound relaxation response. Vajrasana is the only asana we do it after our meal. Why? All our digestive process is parasympathetic. Parasympathetic nerve supplies from your parotid gland all the way up to the renal sphincter. So a Vajrasana, you see all my parents and my grandparents, what they did after their major meal, they were sitting down in a Vajrasana. So the simplest way of doing Vajrasana is that you start sitting, initially you'll be able to sit down here, keep your spine straight. You can sit down here slowly and able to sit down in a Vajrasana. The moment you can sit in the Vajrasana, that you will be able to guide yourself. Next, what is very transformative practice is, which we'll do finally, which is alternative nostril breathing, Anulom Pranayama, and then you will see a purely meditative practice, which is called alternative nostril breathing without closing your nostril. That is your meditation, because meditation, remember what the meditation is. Meditation is able to quiet down your mind. And how do you do it? So if I am sitting in this posture, initially is Arambha, then is a Sthiti, then is a Visarjan, and in the Visarjan I'm slowly entering into my lung, and my breathing becomes so effortless that slowly and slowly I can do 2 seconds in, 4 seconds out, 4 seconds in, 8 seconds out, 8 seconds in, 16 seconds out. We're in a practice in a daily morning. I do 10 seconds in, 20 seconds out. I'm sitting down here. People tell me, oh, look at you. You are extremely flexible. Look at it. I'm not flexible. I'm practicing every day and my brain allows me to sit like this. So look at our daily routine, a dinacharya. What do you do in a dinacharya? In a dinacharya, first thing we wake up. Like a sleep, the way you sleep like a baby. Baby sleeps like a supta baddha konasana. Yogis sleep like a fetal position. They sleep on the left side. And I do it all the time. You get a wonderful sleep. People say, how long you need to sleep? It's not how long you need to sleep, how long you need a deep sleep. Wake up in the morning, we sit down in a asana, very famous asana, Malasana. You sit down in a Malasana. What happens in the Malasana? Look at it. My ankle is relaxed, knee is relaxed, back is relaxed, everything is relaxed. In a Malasana, first thing we do, we keep it. So this is the thing we'll do. I will just keep it on the body side, bedside. Keep a glass of water. Generally, I use a copper. Copper is a very yogic. I will drink a glass of water. I drink in a gulp, one gulp at a time. When you have a gulp, immediately you get a proper bowel movement. Yogic health is called strong digestion, easy elimination, good night's sleep. From here, I'll put my hands together. My hands are relaxed. My fingers separates like this. Wrist is relaxed. Extend my wrist. Put my one elbow inside, other elbow inside. Slowly, I bring my hand in front. Spine is straight. Eyes are closed. Breathing out longer than breathing in. Breathing in, count of 6 in, count of 12 out, count of 8 in, count of 16 out. Maybe we'll do another nice practice with you, a pranayama practice. But most important sign of transformative practice is able to get up without a support. If you can get up without a support, this is a primary yogic practice. Every day, you try to sit down and able to get up without a support. And slowly in the practice, you'll be able to do it very clearly. This is how you get up and stand up in your Dandasana. So like in the morning, after we have a bowel movement, then we brush our teeth and we all scrape our tongue. Very important. Tongue is a window of your GI tract. So I have all these things here. I go to and collect all this stuff. I have a simple, always a tongue scraper. Use a simple stiff tongue scraper. These are all pre-bend. And now a famous everywhere is a copper tongue scraper. Use a tongue scraper. In fact, some Ayurvedic, they have a Ayurvedic practitioner here. The moment the coating comes out, look at your coating. Tongue coating looks white. Today it will be kapha. If it is yellowish, it's a pitta. If it is blackish, brownish, it is your vata. Every day I do jalneti. I do a jalneti, sutraneti. That is my daily practice. I use one of these simple. Here, this is your ready part. Put it in lukewarm water, non-iodized salt, put it through one nostril, and turn my head, close my eyes, open my mouth, water comes out. Flush your one side, just this is your own personal practice. Put it in the other side, do it, and at the end, you do the Kapalbhati Pranayama because you have some water inside your sinuses. Different position. You get head up, head down, head to the side, and then a hit in your forehead. It's called your frontal sinuses. A lot of people gives me gift. I have this wonderful gift. This is a copper neti pot. It's very popular in India now. These are all plastic ones, but now the copper neti pot. So, I get a lot of yogi gift, so I keep it. So, but also, let's see what I do, okay? Beautiful transformative practice. Like all of you guys are in trouble now. For one thing, you use a computer and a computer hunchback. Look at this thing and that causes the large number of lifestyle related disorders. And now is from your IT people, all the software people sitting hunchback. The moment, keep your spine straight. That's your practice. This is my gym. I do it morning practice here. I have a treadmill at this. I do yoga. I do also. This is my Patanjali. This is a statue of Patanjali. Cut from there. So what I'll be doing when I'm in front of a computer? When I'm in front of a computer, I will be sitting with my spine straight. This is what is called a kneeling stool. You use a kneeling stool. I will sit down in a kneeling stool and my back is always straight. I'm sitting in front of my computer. Here is my keyboard. My spine will never be backwards. So if you look at from the profile, this will be my profile look. And this is my transformative practice. And I'm also doing it for the whole day. If I sit down, if I'm eating my food, my spine will be straight. Driving my car, consciously keep my spine straight to drive my car. Sit on a chair, sit all the way to the back, keep my spine straight. So, any asanas which in stages will elicit arambha, sthiti, visarjan are your transformative practice. In stages, in closing your eyes, using Bhramri Pranayama, also you can use a chanting, mantra. Remember mantra, man is a mind, tra is a vehicle, patra, vehicle. It is a vibration of the mantra which cancels the frequency of your brain and quiets down. So it's getting almost getting close to an hour now. We started at 9:10. Let's do a little practice of which you think almost impossible, but it is possible. I will show you a technique how to do Anulom Vilom Pranayama. Then you will be doing a breath-centered Anulom Vilom Pranayama without closing your nostril. So what happens in meditation, that I have a thought process. Every minute I'm generating thought process. Throughout a whole day, I'm generating 30, 40, 50,000 thought process. But remember, most of my thought process are in my past. And that thought process is in my future. Very little thought process I have in my present. But whatever thought process I have at present, 95% of them are called a repeat thought process. Yeah, I have to come, I have to open my laptop, I have to talk to Gaurav, I have to talk to Usha, I have to have this link on my Zoom. It is constantly chattering in my mind. In a meditation, you enter in between the thought process. That's called a gap. Slowly and slowly you extend the gap. So you still have the thought process, which are in a file and a folder, but there is no repeat thought process. That is called Chitta Vritti Nirodha. Chitta Vritti Nirodha is your outcome of your. So now, when you do the Anulom Vilom Pranayama, as I said, we're not doing a practice, we're just showing you how to do it at this is late, almost 10 o'clock at night time. But we do it, as I said, people ask me, how long do you do yoga? So 24/7. I'm doing all the time. Touch your hand like your Dhana Mudra or Gana Mudra. Put your left hand down, the right hand. Close your right nostril. Don't close all the way. Just put it underneath. Breathe out first your left nostril. Breathe in through your left nostril. Close your left nostril. Breathe out through your right nostril. Breathe out longer than breathing in. Breathe in through your right nostril. Close your right nostril. Breathe out through your left nostril. Left nostril is controlled by right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Left nostril breathing is called Pingala. It's called Chandranari, moon energy. Right nostril is controlled by the left brain. Left brain is analytical, is heating, is sympathetic. It is called Suryanari. Slowly then you do, put your index finger and middle finger in the third eye. Close your eyes, bring the awareness, then take your left hand, hold on to your right earlobe. This is called your super brain yoga. Now do alternate nostril breathing. Within a short time, you'll activate both sides of your brain. Wonderful tool for your dementia. Wonderful tool for your Alzheimer's diseases. Wonderful tool for your hypertension. Finally, what you do, touch your index finger and thumb, close your eyes. Generally, you do in silence, but I'm guiding it to you, so I'm going to talk. So first, you visualize your breath. Visualize your breath coming in through your nostril. Your nose is a personal air conditioner. Outside air is warm, it will cool it down. Outside air is cool, it will warm it up. Nose is your personal filter. It filters all the air. It goes to the side of your nostril called a turbinate. It creates a vortex, jet effect. It affects your mucus of your sinuses, which secretes a substance called a nitric oxide. Nitric oxide is a powerful vasodilator. Nitric oxide is activator of your parasympathetic tone. Air is going behind my throat, upper part of my lung, middle part of my lung, lower part of my lung, coming down of the level of your belly button. Here the breath stops a little bit. It is called Kebal Kumbhak. Visualize Air is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat. Air is coming out. Now the breath is picking up prana. Prana is a subtle energy which keeps us awake, alert, and alive. Prana is like an electricity. Breath is not the prana. Breath is the carrier of the prana. If prana is the electricity, breath is the electric cable. In your practice, our whole body does breathing. So slowly bring the prana inside your body. Visualize the prana is coming to organ of healing. For mine is my heart. So I'm visualizing the prana is my heart, called the organ of healing. If a diabetes, visualize prana is in your pancreas. If a back pain, visualize prana in your back. Slowly and slowly, bring your awareness in your nostril. Visualize you're breathing out through the left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Initially, it looked like almost impossible, but when you keep on doing it, you'll be able to do it very nicely. Close your eyes, keep doing this practice, and do it first thing in the morning. Practice, you'll have a wonderful time. Slowly, you bring your hands in front of you, touch your little finger and thumb, separate your ring finger, middle finger, and index finger. This is called a Padma Mudra. Padma Mudra connects your body, mind, and spirit. Slowly bring the Padma Mudra close to your heart. Heart is the site of your soul. A practice of yoga transforms you from a rogi to nirogi to yoga. The moment you're a yogi, you enjoy a disease-free, medication-free, a wonderful life. Slowly bring your hands in front of you, put it in front of your heart chakra, bow your hand down, and then say, Namaste, I honor the divinity within you. It's a wonderful practice. Keep doing it. And it's exactly what will be your time will be 7 o'clock. Our time is 10 o'clock. And it's an honor and privilege to be invited by a community service group like yours. And you know, the divine connects us. Divine connects us for a reason. Most of the time, we may not find what the reason is, but eventually we'll find it. So now we are connected. We'll find it out, what divine is set up for us. Thank you for your time. I'll be glad to answer any question. And Ushaji, Shagauravji, if you can look at, I can see some messages.
Yeah, I can see them. HCI is really honored, Dr. Sarkar. It's been eye-opening for all of us. It's what you're recommending is it's so easily doable if we just make up our minds. So it's just awesome, and we appreciate it that you didn't mind staying up till 9 o'clock and lectured from 9 to 10. Share your thoughts and your experience with us. We really appreciate it. We have some questions here. Okay, and the first one, I think that came up right when they saw you, is somebody has a tingling sensation in the right arm on and off. And they're asking if you would recommend exercises.
I would recommend everything, but always remember that your practice is not a reductionist. It is called a holistic. Holistic means karo yog, raho nirog. Keep doing a practice, your tingling will go away. Why? A money back guarantee. It will go as it's a relaxation response. Now we are in West, we're all have Western trained mind. Western trained mind is called a reductionist. I have a fever, I give me some Tylenol, you know. So yes, I have a tingling. Tingling is from Ayurvedic perspective, it is a vata disorder. So what we do alternate nostril breathing. Alternate nostril breathing, Anulom Vilom Pranayama, in a Vayu Mudra. Vayu Mudra is putting your index finger down, and mudras are different. So this is my book. My book is called Yoga Therapy, Ayurveda, and Western Medicine. Go ahead and get this book. You will have a treatment for every condition you can think about. But look at the book, what is in front. There's a picture of Albert Einstein and Rabindranath Tagore. Albert Einstein is a scientist. Tagore is a philosopher. When a science meets a philosopher, it's your therapy. So when you look at my book, it's all the pictures, every mudras, every asanas, every pranayamas, is all my pictures. Everything is there, how to do, when to do. So if you want to see, I have a tingling, look at that, answer will be here.
Dr. Sarkar, you're frozen for some reason.
But we want you to practice a daily relaxation response, the way I was showing it to you. Stages, asana, pranayama, meditation, arambha, sthiti, visarjana. If you keep on doing it, I can guarantee you in a period of time, 6 weeks to 6 months, the tingling will go away. Thank you for the question. Next one, Sajid.
Next one is they have a frozen shoulder.
Yes.
And can you treat it by yoga therapy and thus avoid surgery?
Sure. Frozen shoulder, the frozen shoulder, basically what you're doing, you have a tear. What happens, the shoulder is a ball and socket joint. A ball and socket joint, the movement of the shoulder, which causes your stretching of the ligaments. One is called the external rotation, when you turn your hands like this. Another is called your abduction, when you raise your head like high up like this. The worst thing what happened in the frozen shoulder, like when you get a small hand baggage in a plane and trying to put it over the tear, you're going to rotate your cuff tear, you don't move your shoulder, and slowly you get into. So what you do a rotation of your shoulder called Skandha Chalanasana with your breathing. Slowly close your eyes, you breathe and do it. Don't go up to your pain. But most important thing, remember, you see, external rotation, you do internal rotation and adduction, opposite of what will affect your shoulder. It is called a Paschim Namaskar. So let me show it to you. If you do a Paschim Namaskar and with your breathing, remember, your breath has to be effortless. Breathing out longer than breathing in. So what you will do, you sit down slowly, take your hands here. Initially, wherever it is, it's fine, stay here. But if you can put your hands together, then put it in a prayer pose, Namaskar Mudra, and Namaskar Mudra will go high up here, and stay in the Namaskar Mudra, and close your eyes, breathe out longer than you're breathing in, and slowly you will see your frozen shoulder will get better and better because relaxation will come in. I have a lot of people with the frozen. I have a very old. This is an interesting story. I tell you. There's a lawyer in my town. There's a frozen shoulder, right shoulder, and he won't move. He won't move his shoulder at all. I said, Billy, it's fine. Why don't you do a Bastrika Pranayama? Oh, Bastrika Pranayama is a pain relieving pranayama. Pain relieving pranayama means it is a prana pradhan. It brings the prana, but it also causes a hyperventilation syndrome. It washes away with lactic acid, pyruvic acid. So what I said, put your hands high up. I cannot do it. I have a pain in my shoulder. So don't do it. Do it with one hand. With the eyes closed. Eyes are closed. He's doing like this. Suddenly I see his right hand goes up and he's doing like this. So what happened? Do you know? He said, no, I don't have no idea. I said, why? My mind was in my breath. I had no idea what my arms were doing. All the tightness comes from your activation of your mind. When the mind quiets down, the pain is also gone. So practice the movement of the shoulder with your breathing. And you'll see they're wonderful. I have actually a whole session. You can go to my YouTube channel. I have a whole session on how to do for frozen shoulder. I have a whole session on that. Thank you for the question.
And then another question is, recommend yogic postures and nutritional guidelines to reduce carotid blockage.
You know, people all, these are called reductionists, you know, so very simple, very simple. What the word I said, this is the new Yoga Sutra. Yoga Sutra is called Karo Yoga Raho Nirog. Huh? There is nothing called food, nothing called guide. Everything comes in a called digestion. People ask me, what do you eat? Are you vegetarian? Are you on the plant-based food? Oh, you know, a lot of cardiologists are saying, you're on a plant-based food, your carotid plaques will be gone. You know why the plaque forms? Why do you have a plaque in the carotid artery, plaque in the, with your blockage in the arteries? It's a tightness. It is called an endothelial health. The blood vessel there is a lining called endothelium. When the blood vessel in a state of tightness called a spasm, the endothelium breaks down. Endothelial health is gone. When endothelial health is gone, then in the crack, all the calcium comes in, all the cholesterol comes in, it forms a plaque, it forms a blockage in the artery. So your therapy is called relaxation response. The moment you learn how to sit down completely effortlessly, the moment you learn how to breathe out longer than breathing in, the moment you learn there is no agitation, when the chitta vritti is gone, your blood vessel relaxes. When the blood vessel relaxes, there is no atherosclerosis, no hardening of the arteries. When you eat a food, that food in Western concept is a calorie. Burn that food. The moment you're burning that food calorie, it's a sympathetic. Our whole gastrointestinal system, parasympathetic is called calm and digest. Our digestion is parasympathetic. The moment you can create a parasympathetic response, your food converts into saptadhatu, rashodhatu, raktodhatu, mamshodhatu, medodhatu, ostidhatu, majjadhatu, shukrodhatu. The moment there is no parasympathetic activation, this food is not digested. The food got a toxin called ama. This ama is nothing but in Western medicine is high cholesterol, high sugar, high uric acid, any metabolic changes which are causing all the plaque formation and the cardiovascular disorder. So therapy is relaxation response, activation of parasympathetic tone, and not to be critical about what you are eating. Think about the food. If we say you're a plant-based diet, you're doing well, do you know the vegetarians? In India, the highest vegetarian is in South India. Highest number of coronary artery disease in whole Indian subcontinent is in South India. Look at the Russians are eating. Look at what the Germans are eating. Look at the lady who died today in the United States. Oldest lady, 116 years old. Every day she had a bacon and an egg. So what is her longevity? Her longevity was let go. Longevity was parasympathetic activation. Longevity is not to have that stress and stressful mind, which creates all the disease in our body and mind. Thank you.
Couple more questions, Dr. Sarkar. This one should be one line. How long to sit in Malasana?
all thing is not how long. It's your initially timing of Sthiram Sukham Asana. If you're in a Sthiram Sukham Asana for 24 hours, 24 hours Malasana is fine. Sthiram Sukham Asana for 30 seconds is good, because in stages, impossible become possible. I was a surgery 40. I've been bending like this, and my neck, my back, I was almost like a stick. But my open heart surgery, opened up my mind, and look at now, I can sit down in the Malasana as long as you want me to. But don't look at your timing. Look at your body's response. Look at your looking inside yourself, introspection. How long your body is allowing you today to sitting in a comfort. There is no twitching, comfort. Sthiram Sukham Asanam is the timing of an asana.
Then I have what to do in pelvic pain.
Again, remember one thing, if I tell you what to do, and if you just do that, it will get worse. I tell people, yeah, I have a diabetes. Now do the Kapalbhati Pranayama, do your Mandukasana, do Vajrasana, and do your Agnisar Kriya, they'll come back and blood sugar is still going higher. Pelvic pain you do is called a Mula Bandh. Mula Bandh, your Udyani Bandh, and Jalandhar Bandh. In fact, yesterday, Shanmoy might know. Yeah, yesterday I did a Facebook Live program. I did up in the YouTube, yoga therapy in the 3 bandhas. My whole session was how to activate the Mula Bandh, Mula Bandh, Udyani Bandh, and Jalandhar Bandh, and the Mahabandh. So Mula Bandh is really a therapy and activation of all the chakras. And another asana, which is very powerful asana, is called your Uttanasana with your Kapalbhati Pranayama. Kapalbhati Pranayama is also very good. So activation of the bandhas. But remember one thing, try not to do them only alone. You need to do first, relaxation of your hands, relaxation of your wrist. I do it every single day. You sit down, I do relaxation of my toes, separate my toes, do my relaxation of my ankles. I will sit down, I would, all these things, what happened, my pelvic pain will be gone. So the pain comes from tightness. See, remember, all the joints, people say, I have a cartilage. The cartilage doesn't have any pain fiber. When there's arthritis, when the cartilage is gone, your muscles and ligaments are all tight. Same as the pelvic muscles and ligaments and tightness. All the pain fibers are in the muscles and the ligaments. So I have a serious osteoarthritis of my right knee, left knee, a lot of crackling sound. But the moment I'm sitting in relaxation pose, my pain is no longer there. It is not going to kill me. So don't practice a one isolated procedure. We are very good in it. This is called a reductionist holism. I'll tell you what to do for diabetes. I'll tell you what to do for hypertension. But if you just do that only and not listening to the doctor within you, you have a doctor within you who is going to be telling you, guiding you, introspection, you'll get into more problem. Not listening. People come say, my doctor asked me to do this. I don't want to do it. What do you want me to do? I say, very simple. Listen to the doctor within you. See what your doctor telling you.
Fix your software.
Wonderful practice, really. Close your eyes, keep your spine straight. Do the breathing out longer than breathing in. You will hear what the doctor is guiding you.
I think I have one more question is, seasonal allergies, itchy throat, watery eyes, and nose that lasts for
Oh
2
my
to
God. You know what allergy is called in yoga? Allergy is called low energy, huh? You don't have any. Allergy basically is your imbalance of your immune system. So think about what is your immune system. If it is weak, you will get an outside infection. And then from inside, if your immune system is weak, you develop a cancer. Cancer is basically your body's really the power to, it's called immunity is gone down. But when your immune system becomes very active, hyperactive, you get that from outside, you get the allergies. So the allergies, what happens, allergies comes from your pollen, from your pollutants, and all comes through your nostril. So recommend the allergy people to do it daily, and not daily, it's a routine every day. It's a lifestyle, Jalneti. Do a Jalneti washing it, and then it is a balance because your immune system is now become responding hyper. To balance it, you do the balancing poses. Balancing poses, very simple. I should have just one day, you learn how to stand on your one foot. Standing up is very simple, balancing poses, you try. This is the thing people say. I mean, allergies, why do you have to do balancing poses with your allergies? Standing up, you see if you can stand on your left foot. Try standing up, closing your eyes. Then do stand with your right foot. Do alternate nostril breathing. All the balancing practices takes care of your allergies, and primarily the Jalneti and Sutraneti. Okay, what's next?
I
It's getting
think
late.
that's it. Guruji, I don't see any other questions. And then the last one is how to contact you.
Me?
How to reach out to you.
Me? I am known to everywhere, you know. You ask, as divine will connect you. I have my email address, I have my phone number, everything on my website. Go to my website, you'll find me, how to contact me. Go to my Facebook, should get to Facebook. These days, nobody calls anymore, you know, it's all through your social medias.
I was the only one bugging you with phone calls, right?
Phone calls, see, I have a grandson. And my son tells me by the time he is growing up, there will be no more phone calls, you know, something like that. Even today, my children never answers phone calls. But if I send them a text, boom, you get it right away, the text. Nobody answers phone call anymore.
Thank you very much, Dr. Sarkar. Again, we really, really appreciate it. Gosh, it's way past your bedtime. Guruji, you want to...
I want to talk to you, Saji, in phone. No. I'm not talking to you. I talked to you a few times.
Yes.
Please connect me. Connect me through YouTube. You connect me through Facebook, through my website. DilipSarkar.com is my website. Connect me.
Dilip, you need to rest now. It's late. It's getting late over there. Shalma Bochi.
I'm not rest though. I'm totally I'm rested.
I know it's a state of rest, but yeah.
I'm relaxed all the time. I'm talking to you.
Right. I know.
You
look good.
What fascinating thing is, see, whatever I say today, I just tell you one very simple thing, which probably it will strike you. Totally unscripted, totally I just say, you take a topic, I just talk. I don't even remember what I said,
Yeah.
That is your state of life, that you don't even remember what I say. And I'm relaxed, I'll go down, I'll go to bed, I'll fall asleep.
Yeah, it comes from somewhere.
Spontaneous, that is spontaneous outcome.
Just before we finish, if you go to bed, have you ever seen a baby, how the baby sleeps? Baby sleeps with Supta Baddha Konasana. Learn to sleep like this. When you breathe, through abdominal breathing, and then slowly turn in a left side, that's why yogis sleep. Yogis put the hand like this. They don't have any pillows, nothing, and they sleep in what's called a fetal position. I have a whole session also on YouTube called Yoga Therapy for Insomnia and Sleep Apnea, and take a look at it, and you'll feel surprised how easily you can fall asleep when you practice. Okay, good night. Thank you for your time.
Thank you very much. Really a wonderful and enjoyable session. Really appreciate you taking your time out.
Thank you, Dr. Saab. Thank you.
I said only
Thank
one
you.
thing.
Excellent session. Thank you.
Yeah, thank you, Dr. Dilip ji.
That's it.
Thank you. Thank you.
Only thing
Excellent session.
I can tell you only one thing. Rastogi ji,
Ji.
you will call, every time I go somewhere, people said after that, when can you come again? I said, I saw a movie and liked the title of the movie, and I gave the answer like that. The title of the movie is called Catch Me If You Can. You have to catch me, I know you. I think Lata, I don't know if Lata is here. Lata was trying for last 3 months to catch me. I'm booked almost whole year, 1 year, sometimes more than a year I'm booked. So you have to catch me, okay?
Okay.
And we are deeply grateful and thankful that we were able to catch you.
Catch me. And you get my book, the most important thing, everything, whatever I say is in my book. In fact, people read my book, he said, they come to my class, he said, sounds like you were talking to me. I'm Shanmay. I said, Shanmay has my book, isn't it, Shanmay?
Yeah, I actually used your book for my master's thesis quite a lot. It's a lot of reference to it.
Thank
Very,
you.
very, very integrative book. Yeah, thanks.
Is
Thank you
Lata-
for publishing it. Yeah.
It is getting published in India now in English. It's a publisher from Delhi. They're a very famous spiritual book publisher called Motilal Banarasdas. I don't know if you heard that publisher. They're a very 100 years old publisher in India. They started their publishing in English in India now.
Fantastic.
Okay.
Okay, good night.
Good
Anything
night.
else?
Yes, thank you, Dr. Sarkar.
Thank you. Good night. Thank
So
you.
your take home message is new Yoga Sutra called Karo Yog Raho Nirog.
Thank you.
Thank you.
Thank you, everyone, for joining us. Appreciate it.
Thank you
Thank
for
you.
presenting this for us. It is excellent.
Yeah, excellent,
Thank you,
excellent
Gaurav ji.
program.
Thank you.
Is Lata?
Thank you for arranging.
Is Lata here? I don't see Lata.
Lata ji may not be on today's.
Okay.
But I'll thank her on your behalf.
Yeah,
Thank
please send my regards because she keeps in touch with me.
you. Thank you.
Welcome.
Thank you, sir, very much. It was very interesting and informative.
Thanks for attending.
Thank you. Thank you.